As an outlet for accessing and distributing prescription drugs, as well as a number of various health products and supplies, pharmacies have become a communal necessity to any society. However, like most distributors of products, they can be inhibited by their stationary status and inability to provide services outside of their shop. PharMobile aims to improve this through the digitization of a pharmaceutical service from store-based to an online retailer. As an online service, PharMobile will have the ability to process and fill medical scripts submitted online by a customer and subsequently deliver the prescribed medication to the customer's place of residence. This method of distribution greatly improves upon the traditional method of in-store processing, as it provides the convenience of being able to conduct the transaction from the comfort of the customer's home, with the added option of express shipping should the customer require the product sooner. As many customers experiencing some form of illness, this method of home delivery removes the need for travel and reduces the potential risk to the customer. Also accompanying this method of delivery is a certain amount of discretion for the customer in regards to the purchases, as some products can be embarrassing or assuming. Finally, the implementation of an online pharmacy is also environmentally beneficial, as the increase in pharmaceutical waste becoming a rising issue. As a result, it has been estimated that a total of 96.3 billion of this waste could be reduced by using a home delivery option. Further convenience is also provided with the implementation of the PharMobile app, as a customer is able to put in or process their order anywhere through their smartphone without having to travel to a store. The transformation to an online service also allows for an additional social component to accompany the shopping experience. This includes reviews of products, shipping time, as well as social collaboration on the effectiveness or experiences of certain prescribed medications. This is likewise an improvement as, while physical stores offer face-to-face interaction, interaction online places focus on the products and experiences relating to them, therefore yielding a greater benefit to the customer. Furthermore, the online service will also be able to suggest other products that users who bought specific products have purchased, many of which may be beneficial and provide further convenience to the customer, as well as create potential for the store to generate further income. Finally, the ability for customers to share their shopping experience and products on various social media sites is a further improvement from the traditional store, as it provides instant advertising, direction, and access to the online store. PharMobile will also have additional services to add value and create features that will excite customers and encourage continual use. These features include the use of notification or text, a loyalty card which will provide discounts, and the extra mile PharMobile delivery services will go for the customer. PharMobile loyalty cards will provide discounts or vouchers to help reduce the cost of buying medication and products from the pharmacy, which in turn encourages the customers to keep coming back. Discounts and vouchers will be targeted specifically to each person to ensure the success of each customer using them at the store, resulting in more money being spent at PharMobile rather than elsewhere. Loyalty cards will be used in each transaction to identify which discounts or vouchers will help customers the most. To predict future purchases, these customers will be grouped with like-minded people. These extra services PharMobile provides create features which enhance its value through the convenience the customers receive, which in turn encourages continual use of PharMobile. PharMobile digital infrastructure consists mainly of the cloud technology that takes advantage of the secure sockets layer encryption between its systems and databases. The systems can be divided into parts such as the website, which serves the user interface, address domain, and the online brand, apps for phones, and the same technology connected to the pharmacy stores. The cloud infrastructure of PharMobile is used for online data exchange, accounting, data storage, web conferences, telemedicine, digital communication access portals, staff recruitment and training services, digital marketing campaigns, and software as a service. In order to combine these services, PharMobile implements the safety of the system with the secure sockets layer between the system's nodes to present a smooth and safe user experience. Australian standard and community pharmacy logo on all templates and branding is another layer of physical integrity to our technology. The customer data is stored in databases online together with our clinical documentation that is updated by the medical staff, who are granted access on their registration to the system with the use of healthcare provider identification and SSL authenticity of staff. For online shopping technology, PharMobile implements e-commerce, typically an online customer transaction system that follows a process that is very much like shopping in the physical world. This includes browsing through the products or services on offer, selecting the item that they want to purchase, placing them into a virtual shopping cart, and proceeding to the checkout. The underlying technical details of this process and how the data is synchronized is explained in the patient-system interactions. Patient-system interaction, which wholly consists of the medical and pharmaceutical staff, has a unique synchronization between the system nodes. To ensure efficiency, users, staff, and pharmacy stores are always updated, and there's interaction between all three nodes. It begins with the diagnosis of the registered patient by the qualified medical staff, who extract the diagnosis and the pharmaceutical needs to the ERX code that is given to the users or patients upon opening their account. User accounts are integrated with specialized medical cards, and any changes made to the website or app interfaces are instantly updated to the system by the staff. Signature verification and card scanners throughout the store are used for automated instant processing. Price comparison and the stock visibility with the subsequent recommendations as well as alternative medications are shown according to the user's purchase history, which is privately stored in PharMobile systems. Should the user require a physical store, the app is linked with Store Finder and able to use GPS services in order to locate the closest store to the customer. To elaborate on the general idea, e-prescribing is a service for electronic transfer of scripts for the dispense of pharmaceutical drugs by pharmacists, as requested online by physicians and patients. Clinical documentation is linked to a patient administration system on the eHealth portal and is firstly matched with the patient identifier number via the Medicare number. A physician's script has a Medicare number, and this assists in the electronic service of providing an e-script through the ERX software application, and this links to the codes on all patient documentation, records, and QR code dispensing. The overall interaction cycle starts with the medical staff diagnosing the patient, and the script/report then gets extracted to a patient's ERX account digitally through transmitter using e-prescribed interface. The report is synchronized between the user's account in the app, website interfaces, and the pharmaceutical store's databases. The report can also be printed if the patient requires. The diagnosed patient can get directions from either the app, which uses their GPS location, or with the web interface, directing them to the closest store that has the necessary drugs available using their registration address stored in the database. With a large increasing demand for prescriptions in the coming decades, mainly due to population increase, new technologies will need to be developed in order to handle more orders. Thus, any new technologies to help deal with this large increase in prescriptions will be a no-brainer investment for pharmacies. It will be very difficult for pharmacies to keep up with this demand otherwise. Our system will help alleviate the pressure on pharmacies by having more automated systems handling prescriptions, less manual labor, replacing scripts with e-scripts. Scripts are verified online by automated processes. Scripts cannot be misplaced by users, so there will be less incentive for doctors to use it since people won't need to come back. The new technologies will reduce the time needed to process each order, thus more people will be served. Increasing demand on pharmacies are driving the need of new digital technology. The main things that will impact the users of this system will be perceived usefulness and ease of use. Ease of use will be high because almost everything is already done in the back end for the user. All the user is required to do is register themselves on the system to begin, and all their scripts will be taken care of for them. The entire experience is streamlined and makes ordering of the user's scripts as easy as pressing a button. Perceived usefulness will also be relatively high, as the previous hassles of ordering prescriptions, misplacing scripts, forgetting to order, is bypassed by the digitalization of the scripts. The system already has all of this information. Subjective norm also has an effect. As most people are used to getting their scripts from the doctor to then go straight to the pharmacy, some users may be reluctant to adopt this new system because it is not what they are used to. Thus, this will slightly impact the behavioral intention, but ease of use and other factors in perceived usefulness will vastly outweigh that. Job relevance to pharmaceuticals is also high, positively affecting perceived usefulness. The Australian Government's approval of PharMobile will be necessary as the system interacts with sensitive data from eHealth and Medicare, so PharMobile will be under the influence of NETHA standards and government monitoring. The system itself will create efficiencies within the pharmacy and script processing method, allowing for customers to save time and money. PharMobile improves the pharmacist's productivity by cutting down manual labor, usually involved in paper-based script processing, and supports relationships with pharmaceutical suppliers. Individuals who use medications frequently will be most impacted by the implementation of PharMobile, as PharMobile changes mostly the way the customers act within the scripting process, going from a paper-based system to an online delivery system or an iPhone order and pickup type procedure. Doctors and medical admin staff will also be affected by the change, but with PharMobile integrating the EMX, which is already in use, the changes to the doctor's side of the process is minimal. Medical administration staff will need to be trained in the new software but should ultimately just need to link a patient's information using PharMobile. Australians will be impacted by the implementation of PharMobile as they will be further encouraged to use e-health, so the medical records can be linked with prescriptions and such on their Medicare cards. E-health allows the public to manage their healthcare and encourages health literature to further the public's education about their health. PharMobile will promote a healthier Australia, providing time-saving solutions for pharmacists and patients, improving patient care and services through their use of technology.